Hi. So today I was listening to a few songs from Hillsong Worship, and there's one that caught my attention more than the others. Because sometimes you listen to a song and you listen to the lyrics and you feel like it's saying something to you more than it was before. And now that I'm grieving and I'm crying and I'm having a hard time accepting that AF is here, and I'm kind of fighting it without like kind of fighting the fact that I don't want it to be here, and I feel like it's harder this time. So I've been listening to I Surrender because sometimes you feel like you need to give up on and you need to accept it. And sometimes like I am right now, I'm fighting it and I shouldn't fight it. I should just not be angry and accept that, all right, this is it. And so that song, it's like I listen to it pretty much on repeat right now. It's I Surrender from Hillsong Worship, and it's like giving it all to God, and there's nothing I can change about it, and I'm trying to be happy in a sense that even though I'm sad, I'm trying to be happy and enjoy the day and all. And it's only been a few days that I started AF, so I'm still at the beginning of a grieving process, so I can't really expect myself to be all cheerful and sunny and everything, right away. So I'm happy that I found that song because I've been listening to a lot of songs the past few days, and when I heard that one, I was like, okay, I need to listen to that one because right now I need it. I need to let go, and that's good for me because every lyric is like, God, I take the pain away and just like help me, and I surrender to you and I give it all to you, So as for AF, it's so weird. So I don't know what's happening with that. Like I know that the progesterones are messing up my periods and my cycle and all, but it's been like 3 days spotting on and off, and the blood is weird and everything's weird. So I know I'm out for sure because I had a negative pregnancy test, and usually the HCG test, HCG test, it like you can catch on pretty even though with the progesterones, even though it's messing up your periods and all, it doesn't mess up the pregnancy test. So I know it's negative. It's just right now, I'm in the come on, start a full abundant flow, but it's not starting. So I'm kind of like, oh, come on, just stop playing with me. Just start already, So I've been thinking about asking my doctor for Clomid for a few months because I've always tried Femera, and we never tried Clomid. And one of my friend, she had like 2 IUIs, and the first one, that's my dog and my cat playing together. Here, my baby cat is playing. I'm gonna hold my baby, my sangria. So, like I was saying, my friend, we've met. It's funny how we met. We met at a restaurant, and we were both eating. We were neighbors, table neighbors, and we were talking to each other because of our dog story. So anyway, she had 2 IUIs, and the first one she had to use Femera and the trigger shot. And the second one she used Clomid. She asked for Clomid because she heard that Clomid was better than Femera. And actually Femera is a little less invasive on your body, but then again, at this point where I am, I feel like I should start Clomid because we tried Femera for so long, and right now nothing worked. And just for the little fact that I would like to still ovulate while waiting for IVF, and since I do not really ovulate on my own, I feel like it kind of sucks because Clomid isn't expensive. It's gonna cost us $25 for 3 months on Clomid. So I've set an appointment with my doctor so that I can ask him if I could start Clomid, because when I called to speak with the nurse to just see if I could get a prescription pretty quickly. They know my medical file, so they've seen it all, and she said that I would need to go see the doctor to ask him So I'm sure that when I'm going to ask him, he's going to pressure me to go through IVF. And I want to go through IVF. Like, I'm at the point where I'm okay with it. I'm still scared of the procedures, but, you know, the egg retrieval and the transfer, I'm scared about that. But, you know, it's just my anxiety. It doesn't mean I'm not going to do it. But in between, you know, for $25, why not just do Clomid? At least I'm going to be ovulating, and I'm going to feel like I'm not wasting so many months in between, you know? For $25, it's not a big deal. And I'm not going to do like the whole year on Clomid, because I know it's not good when you do too many months consecutive on Clomid. So I'm going to do like 3 cycles with Clomid. And if it's not working, it's not working. But at least I won't feel as if like I've wasted so long, you know. And since, like I said so many times, the time is not on their side, so I feel like I don't want to waste a full year. So I'm gonna ask for Clomid. And my other friend who has the egg that are frozen, that she keeps telling me, you know, you can take those and it's gonna be less expensive for you. I'm still waiting for my DH to be open to that idea. And I know that, you know, it's different for me, because, you know, men and women, we go through this differently, because we are faced with the injections, we are faced with the cycle, and every month we have AF, we have the symptom spotting that we do all the time. So for us, we're at a further point, and us women, we all always think ahead about the future and what we're going to do before men. And I get that. And since he isn't confronted with all the things that we do, and he doesn't really want to help with injections because he's not comfortable, and I respect that, because I don't want him to be near me and feel like he's uncomfortable and he's going to pass out on me, like, just because he sees a needle or something. So I don't want him to do that. So I want to make sure that he's all right and he's at the same page as me. And, you know, sometimes I got to be patient, because it's not because I'm at that level of TTC that he's right at the same level as me, because sometimes it takes longer for someone, and it's all right. It just, you know, I understand. I don't want to pressure him into being ready for something that he's not. Like, he's got to go through his process of accepting whatever we're at, and whatever we're like we're all at different levels, like I've said anyways. But like, I want to make sure that he's accepting and not being pressured by me, you know. I don't feel like that's okay. So eventually, if IVF doesn't work, of course we're gonna go for egg donor, because we talked about it. I don't know if he's all right, because he mentioned a few times that he wasn't all right with the fact that he was a friend. He would prefer that it be my sisters, but my sisters can't, because right now one of them has health issues that I already knew that I wouldn't ask her, and the other one, well, right now, after her last birth in December, she had issues too, so I don't want to put that on them. So maybe in the future, if IVF doesn't work, maybe he's gonna think about my friend offer, you know, who knows, or maybe he's gonna go straight and tell me that he prefers to have someone that he doesn't know, because I feel like for some people it's easier that they don't know the donor. I think if it's a friend, I'm okay with, but I don't want to have an image of who could be the parents or whatever. I know I'm gonna have to tell my future kids that this is how they've been created and how I was and all. I get that, but, you know, I'm not there yet. So it's spring here already. Well, it's not exactly spring, but it's a spring weather. So I'm just focused right now on trying to do the nursery. I've been through the clothes again, and I cried a little bit doing that, and it felt good. I've looked at some outfits that could be so cute on a baby. I think I'm gonna borrow my sister's baby. Nah, I don't think I'm gonna be able to have a little tiny baby in my arms. That is not mine to cherish, mine to love and see grow, you know. So anyways, I wish you the best. I really hope this year is our year, even though, like, it's just the beginning of the year, you know, like, we're only in March, so we still have like 7 months to go to actually be okay. It's not this year. And let's hope this is it. And if not, well, we're going to continue to hope because, like I've said, we're not ready to give up. We're not ready to give up. We're fighting, and I'm fighting, and he's fighting. So we're both fighting because we want this to work. And he really refused a trip with his boys to make sure that we had the money saved for IVF. So, you know, we're really on the same page as when it comes to IVF. We really are ready for that. So, baby Les, I wish you the best, and I'm praying for you guys.